Welcome everyone. Before I start though, I'd just like to acknowledge the wonderful work that the Mental Health Foundation Australia does to assist, support and help the mental health of Australians. I'm not sure whether you all know, but they've actually been going for 90 years. So that's a really outstanding achievement, Jim. So I'd just like to acknowledge Mental Health Foundation Australia. Wonderful,
Thank you
wonderful.
very much,
So, COVID-19. It's a different world we're living in at the moment, and it can be quite scary. And for some, that level of fear can be higher than others. And some people can show that level of fear in like many different ways. Like we as all individuals, we're all our own unique, amazing, wonderful selves. But we've all got our own unique stories and had our own personal histories, our own life experiences, our own history of health, education, relationships, families, upbringing, religions, you know, everything. So, and every experience makes us who we are. So sometimes dependent on those experiences can also be dependent on how we manage emotionally, and especially during this coronavirus pandemic. So I hope you gained something really helpful from today's webinar. I know we've got a range of people from lots of different areas, so we're covering a broad range of information. So hopefully you will get something out of it. So the topics. Today we're going to discuss what is PTSD. And most of us know the term and have heard the acronym many times, but not everyone knows what it actually is. So we'll be discussing that, we'll be discussing its symptoms, and we'll be talking about some statistics. What is anxiety? So we'll be discussing what that is as well. The symptoms and signs to look out for, and also talking about some statistics. We're going to do a little breathing exercise in the webinar today, and obviously you'll have a choice whether you want to join in or not. And it's just a really quick breathing exercise that can show us how easy it is to use our breath to help calm us. We're going to learn about COVID-19 and the impact on our mental health. We're going to learn how to make a mental health safety plan for ourselves. And we're going to be covering how you're going to feel returning to the world when we come out of isolation, when we come out of lockdown. I'll also be explaining what psychotherapy is and describing some ways in how psychotherapy can help you. I'll also let you know like when it's time to seek help, and I'll be providing a list of numbers and services to call for help. And in a slide later in the webinar today, I'll be providing a whole heap of numbers and places that you can call. And then we're going to finish up with some questions and answers at the end. So I think, Jim, that's right. People can type questions throughout it, and you're going to be managing those. Is that right?
I can indeed, yes.
Wonderful. All right. So let's get started. Next slide, please. So PTSD stands for post-traumatic stress disorder. So, and according to the World Health Organization, the definition of post-traumatic stress disorder, PTSD, is that it is a disorder that develops in some people who have experienced a shocking, scary, or dangerous event. And COVID-19 definitely is a shocking, scary, and dangerous event. So PTSD is a particular set of reactions that can develop. So if you've been through a trauma which has threatened like your safety or the safety of others around you. So some common examples of those types of trauma are, and they're different for everybody, as I said, depending on our life experience. Something that might not be traumatic for someone could be traumatic for someone else. So some common examples are physical, emotional and sexual assaults, serious accidents, war, torture, or disasters such as floods and bushfires, which Australia's already had, and now we've got COVID-19. So while it can be natural to feel afraid or anxious during and even a little bit after that traumatic event or situation, if the symptoms do continue for an extended length of time, so on average, say a month, you could have PTSD. Next slide, please. So the symptoms of PTSD. So the symptoms can appear soon after the event, or sometimes they can even appear years later. What I've got here is a list of some common symptoms, but there's a whole other range of symptoms that people could have depending on the traumatic event, as I said, or their life experience. So these are just some of the more common ones. So we could re-experience the trauma, and that could be by memories, by having nightmares, and by having flashbacks. We could be very alert, be in that fight or flight response. We could experience like a physical reaction to sudden changes or sounds, or sometimes even smells, whatever is linked to that traumatic event. So an example of that is like getting easily startled when something happens. And I guess we've all experienced at some time in our lives, you know, where we've been startled or surprised, so we sort of jump. But with PTSD, quite often that's a recurring and a frequent response, not just like a once-off every now and again like most of us. The additional thing about fight or flight is that when we are living in that fight or flight response, our bodies can also physically be held in that tightness of tension. So we've probably all experienced sometime in our life having that sore neck and the sore shoulders, which we get, and we know we're stressed, we're overworked, overworried, whatever. We know that that's a sign of that. So I want you to think about what you think would happen to your body if you are always or frequently in that fight or flight response. So our muscles tighten, and, you know, even our internal organs. So it can also affect us physically, not just our mental health. So it's really, really important to notice the signs. So some other symptoms may include avoiding the reminders, which we call triggers. So avoiding the reminders of the trauma. We can also experience negative thoughts and moods, including depression and anxiety. And we could experience perhaps some feelings of hopelessness. We could start overthinking or worrying excessively. We could have overwhelming feelings of anger or guilt. We could experience insomnia. We may even emotionally detach ourselves from our lives, our jobs, our education, our families, our loved ones, our friends. And sometimes we may even get to the point where we're unable to find happiness or enjoyment. And you could also experience some agitation and negative changes in your behaviour. So as I said, these are just some of the like common symptoms of PTSD. There's a whole lot more, but this is just some that you may experience. So it is really, really important for both our mental and physical health to seek help sooner rather than later if we experience any of those symptoms, as I said, for that prolonged period of time. Next slide, please. So there's PTSD statistics in Australia. So according to the Australian Government Health Direct website, before COVID-19, PTSD affected around 1 million Australians every year. And while it's currently too early to get accurate statistics on how much that number will increase due to COVID-19, there's a lot of talk in the mental health community that it could increase by possibly 3 to 4 times. So possibly up to 4 million Australians could be affected by PTSD, but we're really not going to have statistics till later down the track. And I don't know, Jim, when you think that they'll come, but we'll probably have maybe 6 months, 1 year, sort of how it's affected. Is that what you think would happen?
Yes, I think so. Maybe
yeah,
long.
Yeah, absolutely. It's going to have a long effect. So look, PTSD is treatable, and the sooner you seek support, the earlier you can recover. So it's really, really important to seek help sooner rather than later, and I really cannot emphasize that enough. Next slide, please. So what is anxiety? So anxiety is more than just feeling stressed or worried. And while feeling stressed or over worried or having anxious feelings can be responses to situations where we feel under pressure, those things can usually pass once that stressful situation has passed or has been removed. So everyone can feel anxious from time to time, and that's okay. But when those anxious feelings don't go away, or they begin to happen without any particular reason, or it begins to become hard to cope with your daily life, then that may be a sign of an anxiety condition, and it's really important to seek help. Next slide, please. Okay, so the symptoms of anxiety. So again, these are just some common symptoms. People can experience a lot of other ones, but these are, a list of some of the common ones. So panic attacks, heart palpitations, that tightening of the chest. You could breathe quickly, have trouble catching our breath. We could feel hot and become sweaty. We could feel restless. We could get the shakes. We could feel that tense and that wound up and on edge. You could experience excessive fear, worry, obsessive thinking, or thinking that the worst is always going to happen. And you could have trouble calming your mind and even thinking clearly. You could start to avoid situations that make you feel anxious. And this could impact, again, on your daily life, including your work, study, family, and your social life. So again, if you're having any of those symptoms, it's really, really important to seek help sooner rather than later. And there's lots of help out there, and I'm going to be telling you at the end how to get it. Okay, next slide, please. Oh, anxiety statistics. Okay, so according to Beyond Blue, anxiety is the most common mental health condition in Australia. And they state that on average, 1 in 4 people, and they've broken it down to be 1 in 3 women and 1 in 5 men, will experience anxiety at some stage in their life. So Beyond Blue state that in a 12-month period, around 2 million Australians experience anxiety. So again, while it's currently too early to get statistics on that increase of the numbers due to COVID-19, mental health professionals are predicting a really significant increase in the number of people experiencing anxiety, obviously during, so at the moment and after. Okay, next slide, please. All right, we're going to do a little breathing exercise. I've been telling you a lot of information, so I'd like to share this little breathing exercise with you, and it's something that can be done quickly and easily, anytime, wherever you are. If you don't want to do it, you don't have to do it. This is completely your choice. If you can't do it, you don't have to do it. So what I'm going to get you to do in a minute is I want you to take a nice deep breath in, and I want you to hold it for 3 seconds. If you can't hold your breath for 3 seconds, 1 second, 2 seconds is fine, whatever you feel comfortable with. And again, if you don't want to do this exercise, you don't have to, it's your choice. So get ready. When we're ready, all right, let's take that nice deep breath in, breathe in, 2, 3, and out. Good, feels good, doesn't it? So in a moment, I'm going to get you to do another one. So when you're ready, let's take that nice deep breath in, 2, 3, and out. Excellent. Feels nice, doesn't it? We're going to do one more of those breaths, but before we do it, when we breathe out at the end after the 3, I really want you to blow that breath out. So I really want you to really, really blow it out. So, again, when you're ready, here we go. Let's take that nice big breath in. 2, 3, and really, really blow it out. Good. Well done. Now that's just a nice, easy exercise just to help bring you back, just to calm you. You can do it night, day. It doesn't take any time out of your day. Just a nice little simple technique that you can use. So now that you're feeling a bit more relaxed, we're going to talk about the effect that COVID-19 could have on your mental health. Next slide, please. Oh, good. The COVID-19 pandemic is being called, as we know, a once in 100-year event. And it certainly is something that none of us have experienced. It's changed our lives and the way we live, the way we shop, the way we work or don't work, the way we interact with others, the way we educate ourselves or educate our children, our social lives, the way we parent, and especially for those parents that are homeschooling at the moment, the way you're parenting could have some changes. And I just want to say to those parents, be kind to yourself, because it is a really hard job. And I'm going to tell you that you're doing a good job, because I'm sure you all are. Be kind to yourself. You can only do the best that you can do. And the same to the teachers out there that are at the webinar today. The same to you guys. Be kind to yourself, because I know that you're working really hard as well, and it's all changed conditions. It's also affected the way we exercise or do sport or don't do sport, as it turns out. Our interactions with our family and friends, and I know that we've all missed out on, a lot of events, a lot of big things have had to be cancelled, and a lot of people haven't seen family for a long time. And for many of us, it's also affected us financially. And for people who are following, there's lots of different people and different religions. For them, it's also affected how they practice their religion. So it really has affected us in nearly every aspect of our life. Next slide, please. Okay, so we could currently be feeling anxious about all these changes, and as well as our health and the health of those that we love and care about. These anxieties can be quite normal, and it is a different situation, and we don't currently know the outcome, and that can cause additional anxiety. If you think about some challenging times you might have had in your life, we've had some things happen that are quite challenging. More often than not, we've known someone who's gone through it, or we've heard about someone that's gone through it, or we know information about what's gone through it. But at the moment, because COVID-19 is a new experience, we don't really know the outcome completely. We don't sort of have that idea. So that can increase our anxiety by not knowing how things are going to turn out. So if your anxiety is to a point where it's not subsiding and you're finding that you can't function in your normal day, then it's really, really important to ask for help. Next slide, please. Okay, asking for help. Safety plan. Let's talk safety plans. It's important to have a safety plan for when or if you start to feel overwhelmed or anxious, or even have a panic attack. Often when we feel like that, we can't think clearly. And it's good to have a little note somewhere to remind us of some techniques and ways that we can calm ourselves. I find using the notes section in my iPhone a really good tool, and a lot of my clients do that. I don't know if the Android has something similar, I'm sure it might. Or you might even prefer to just write it on a card or a bit of paper and have it in your purse or wallet, whatever's going to work for you. But this safety plan, on this little note, I want you to write reminders of what you can do to calm yourself when you're feeling unsettled or heightened. I'm going to talk about some samples of that on the next slide, please. Thank you. Okay, so again, these are just samples of safety plans. It's really important that you design a safety plan that works for you. So these are just some samples. So you could do the 3 breaths that we just did. You could recite the alphabet backwards. You could say the colours of the rainbow. You could remind yourself of your favourite musician or band that you used to like when you were younger, or even that you like now. And perhaps maybe remember one of the favourite songs that you like and try and remember the lyrics. If you're an animal lover, you could say out loud as many different breeds of dogs or cats that you can remember, whether you're a dog or cat person or both. Yeah. So as I said, it's a safety plan that works for you. So they're just some examples, but something that really is a not negotiable that you should have on there is writing the name of a person to contact. If you can't calm yourself, if you're really, you know, at that heightened feeling. And it's important to have 2 or 3 people on this list, because if the first person that you call, excuse me, is not available, then you have a backup. And for those that don't have 2 or 3 people that they can call, as I said at the end of the webinar today, there'll be a page that's going to have some helpline numbers to call. So again, the helpline numbers are good to have on there. Now you'll see that I just skipped over the suicidal thoughts one, because it is really, really important that if you are having suicidal thoughts or thoughts of harming yourself or other people, you need to call 000 immediately. And it's really, really important to remember that, and it's good to have that as a reminder on your card. Because as I said, when we get in that heightened state, if we're feeling anxious or having panic attacks or flashbacks, we're not thinking clearly, our mind's not working, whereas, you know, you're sitting there now, you could be saying, oh yeah, I could do this or I could do that. But when you're in that moment, you can't get your thoughts clear. So just knowing you have that note somewhere that you can look up and go, okay, I'm going to do this, I'm going to do this, I'm going to do this. And look, the reason I put things like recite the alphabet backwards or to say the colours of the rainbow, it's because it's making us think of those things. So it's changing our focus. Because quite often when we're feeling anxious or having a panic attack, we're focusing on that. So we're actually increasing those feelings because we're focusing on it. So having those little tricks, reciting the alphabet backwards, you'd really have to think hard to do that. You know, say the colours of the rainbow, remembering those, you know, the songs. And I guess for the teachers out there, you know, you could think of some things that could work for the children in your classroom, you know, age-appropriate stuff. Obviously, yeah, and the helpline number that you can call, and I'll be giving you those at the end. And anything else which may be useful at the time. So again, design it to suit you. Okay, but the must-haves are the name of people to call, and to remind you to call 000, okay, and some helplines, at least one. Good. Okay, next slide, please. So, how are we going to feel returning to the world out of isolation? It can feel daunting returning to the world as our isolation restrictions lift. And it can also be a bit confusing because a lot of the states in Australia are doing things at different times. So we could all be confused about who's doing what. And it can feel daunting and it can make us feel anxious. You know, returning to that life bit by bit, we could live with that fear or that anxiety that we or someone we know and love or care about could become sick. Or even that we could make someone sick. Some people are asymptomatic, so don't have symptoms, and can really worry about that as well. So really, life as we know it will never really be the same. Social distancing will most likely continue for some time, and washing our hands and not touching our faces will also continue for some time. And they'll most likely become normal habits for us. So this is really interesting. We're not born with habits, we create them. And it takes about 3 weeks to create a habit. So we've been living with the COVID-19 pandemic for quite a while now, longer than 3 weeks. So we may find that we've already adapted now to our current situation, and our new normals are now our new habits. we automatically social distance without thinking about it. We're regularly washing our hands. We're doing those things without thinking about it, and it has already become a habit. So you may find that that's already happened. Next slide, please. So I can't emphasize enough to you how important it is to keep an eye on your own mental health and the health of others around you, not just those that you love and care about, your neighbours, people at work, people at school. Like really, really keep an eye on other people as well and their mental health. And look out for any of the signs of the symptoms that we've discussed today, or even just some signs sometimes that don't feel right. And don't wait to ask for help. The sooner you seek help for anxiety or PTSD, the quicker the recovery. Don't ignore. Anxiety and PTSD are also known to be linked with substance abuse and a whole other range of things which we won't have time to talk about today. So don't get yourself there. Don't wait. Ask for help, because there is no harm in asking for help, but there can be harm in ignoring the symptoms. Okay? Good. Okay, next slide, please. What is psychotherapy? So, according to the Psychotherapy and Counselling Federation of Australia, psychotherapy is the comprehensive and intentional engagement between a therapist and a client for the healing, growth, and transformation of their emotional, physical, relationship, and behavioural issues. And this is done by using a variety of well-founded interactive processes and techniques and modalities that are all designed to help with the client's mindset. So for their range of issues, what they come with. So while psychotherapy traditionally has been done face-to-face, one-to-one, in office and clinics, during the COVID-19 pandemic, it's become really popular to be done online. And I know with my clients, I see them via Zoom, Skype, or FaceTime. They get to choose which one. And some of my clients that have been a little bit resistant about doing it online have found once they do it, they're like, oh, that was great. I was sitting in the lounge, I was comfortable, I was warm, I didn't have to leave the house. That was really good. But for, I guess, other people have really busy households where there's young children or lots of kids, teenagers, partners, where it's a really busy house and hard to find a quiet space or time for privacy. Face-to-face would, be the preferred method for them. So I believe as we come out of isolation and as restrictions are lifting, I believe that a lot of therapists, and I know that I'm going to be doing this, will continue with some online sessions and also doing face-to-face. So you'll find you'll probably be able to access either as these restrictions lift. But if you are wary of trying, the online, give it a go. You may be surprised. Okay. Now, good. Okay, next slide, please. Okay, so how can psychotherapy help you? It can give you someone highly experienced, impartial, and non-judgmental to speak to in a safe, secure, and confidential space. It can allow you to feel like you're not alone. It can help you identify your triggers to your issues, to what's been going on for you. It can also give you tools and techniques to use in your everyday life. It can also help you release those fears, those worries, those phobias, all those sort of things that are triggers for you, or that are, negative behaviours, things that you're wanting to change. And it can change negative and harmful behaviours. It can also help you remove emotions attached to specific events so that you don't have to relive those emotions over and over. And this is really, really good for people suffering with PTSD. quite often, as we said, they're re-experiencing that emotion, that event, and they're feeling that emotion over and over and over. So I find that the clients I see for PTSD, I help them remove the emotions attached to those events. So they go back, when they think about it, they're like, oh yeah, that happened, but they're not reliving that feeling. So they're not being re-traumatized every time they're thinking about it. So psychotherapy can also help empower you by giving you self-esteem and confidence to get back on with your life and for you to be able to live your life to your full potential with nothing holding you back. Okay, so what I'd like you to do now, I want you to imagine from the very first moment you were born, you're put in a car. This is your car, and you've been in that car. That car's been around with you your whole life. As I said, I think the ages here are 18 to 65, so everyone's in different age groups. But I want you to imagine that you've been in this car from the day you've been born. It's been with you the whole time. I want you to imagine, like, think how badly, how poorly that car would run if it had never had a service and a tune-up. It would run pretty badly, wouldn't it? It may even conk out, may not have been working. So, you know, depending how old our car is. So I want you to think about that as your mind. Our minds are with us from the day we're born. We all have lives. We all have things happen to us. We all have things happen to us that are good and not so good. And to keep our minds running smoothly and effectively, just like our cars, it's really, really, really important for your mind to have a service and tune up. So I really want you to encourage you to not ignore the symptoms, because for your mind, you know, to continue to run smoothly, it really needs that sort of regular service and a tune-up by seeing a therapist. So next slide, please. Okay, so when and where to seek help. Excuse me. If you're finding your symptoms aren't improving after a week or so, see your GP. They're doing telehealth appointments at the moment, so you know, you don't even have to go in. You can, I think, some you can go in, some you can have telehealth. I think you have a choice. But below here, we have a list of telephone numbers that you can contact as well. So as Jim said, I think everyone attending today will get a copy of this presentation. So it'll be a really good reminder of some numbers there for you in case you haven't got a chance to jot them down. And a lot of these organisations also have web chat as well. So check their web pages for more information for what's going to work for you and be more comfortable for you. But again, please note, if you are having suicidal thoughts or thoughts of harming yourself or others, call 000 immediately, okay? Good. Okay, so the Mental Health Foundation Australia's helpline. It's available 9 AM to 11 PM, 7 days a week. Now, there's also an email address there, but I just want to clarify that that's not an email address to email if you're in crisis, if you're in that heightened state and needing to talk to someone straight away. It's an email address that you can email for information. So if you're in crisis, if you're in that heightened state, don't email, use the phone number. If you want some information, you can email. Then there's also Lifeline, which is available 24 hours a day, 7 days a week. There's the Suicide Line, 24 hours a day, 7 days a week. There's a suicide callback service, again, 24 hours a day, 7 days a week. And then there's Beyond Blue, again, 24 hours, 7 days a week. So lots of helplines available then and there. If it's 3 o'clock in the morning, you can call. So you can also see your GP, and you can also book to see your psychotherapist or your psychologist or your counsellor.